Mother's Day is just around the corner. It's Sunday, by the way.
It is Sunday. I'm ready. I'm ready.
I know you all know too. So we want to do something really important. We want to talk about something that is sometimes undercovered, maternal mental health. It is Maternal Mental Health Month every May. It's meant to raise awareness about perinatal mood and anxiety disorders. The U.S. has the highest rate of maternal deaths among high-income countries. It's still hard to believe. And disproportionately, that affects Black mothers. But mainly, many deadly conditions are preventable with proper prenatal care. So joining us to talk about all of this is Dr. Kemi Doll. She is the author of A Terrible Strength, The Hidden Crisis of the Black Womb and Survival Guide to Healing. She's also a gynecological oncologist and uterine cancer scientist. Dr. Kemi, welcome. I was intimidated by all of the letters in that word.
All the Latin medical terms.
So, Doctor,
thank you for having me.
Thank you so much for being here. Just tell us how we've arrived at this moment in maternal health, that it's become such a crisis in this country, despite how advanced we are.
Yeah, unfortunately, in this country, we still have some long-standing disparities about how we treat women based on who they are, where they come from. And so that means that we have a lot higher rates of maternal mortality than other countries. We also have women that are getting pregnant with more chronic conditions that are sicker when going into pregnancy. And unfortunately, we don't have the same safety net that other countries have in terms of excellent prenatal care throughout the pregnancy and beyond, especially in that time after birth.
So you mentioned how we have the highest mortality rates versus other countries, but I think what we should point out, it's other countries that are industrialized, wealthy countries like the United States. I mean, and that is, I think, what is shocking to a lot of people. We talk about how great it is to be an American, how great this country is, but at the very essence, at the very beginning of life, we make it harder for mothers to have children here than it is for children and for moms in France or Britain or Canada. Why is that?
I think there are a number of reasons, but the bottom line is that when it's difficult to access care, when care is expensive, when you have to choose between whether or not you can afford your doctor's appointment or whether you need to go to work, these things impact whether you get the appropriate prenatal screening. They impact whether or not your maternal complications are caught early enough so we can do something about it. And then it's important to also remember that 30% of maternal mortality actually happens after birth. And so when we have such a cliff after birth, we kind of, wipe our hands and say, Mom, good luck. We're missing a lot of complications that can happen after birth, which is almost what happened to me. I had postpartum preeclampsia, which is a very dangerous condition. And my life was threatened, and I had to go back into the hospital 8 days after delivery. And I could have died if I did not have prompt health care. So it's really important to remember for mothers that the health and the danger and the concern continues after delivery, and we really need the kind of robust support and access to care after that time.
Because, doctor, as you know, after delivery, all the focus is on the baby, typically, and a lot of mothers feel awful regardless because of it's a trauma that your body has gone through. But you're so right, it's important to kind of note, what symptoms you're having. You're a doctor, so you probably knew, whatever it was, maybe your blood pressure was high or your heart was racing, that you needed care. But talk to us specifically about the disproportionate effect on Black mothers. What is going on there? I mean, do we see any differences in how Black women, their experience, does education affect it? And do we still see those disparities when their caretakers are also Black?
So we absolutely see disparities in Black women regarding maternal care, regardless of their education level, regardless of their income level. And unfortunately, what we know is that a decent proportion of this is driven by bias in the healthcare system, where when Black women come in with the kind of conditions that should prompt alarm, like headache, like pain, like blood pressure that's too high, they're not met with the same concern, and things can accelerate too quickly. And then it's too late to do anything about it. So that's a major problem. We have had incredible Black scientists and Black physicians lost in that time after delivery because their symptoms weren't noticed. And so in the United States, unfortunately, we have around a 30 to 40% higher maternal mortality rate for Black women across every education level, across all socioeconomic statuses. And it's something that is quite shameful, and that those of us in OBGYN are very committed to raising awareness about, but also changing practice in our field so that we treat all women the same regardless of what they look like.
Dr. Kemi, before you go, does it, and to Adriana's last point in her question, does it matter if your caretaker, your OBGYN, is a person of color, is a Black person?
Thank you so much for asking that. So regarding the data, we don't have the specific data about in OBGYN, that caretaker. However, what we do know is that across all conditions in medicine, race concordant care, which is when you have a provider that matches who you are and can understand your background, improves outcome 100%. People have better quality interactions. They're more likely to share their concerns, and then those concerns are more likely to be intervened on. Mm-hmm. So in OBGYN, nearly 13% of us are Black women. So there are providers out there that can match with other women who are looking for that kind of specific and culturally competent care.
So important, Dr. Kemi Doll. Thank you so much. And trust is such a big part of that.
100%.
You know, a lot of patients who, really trust providers who they feel and understand them. Thank you so much, doctor. We'll have more news after the break.
Thank you so much.
Thank you. This is CBS News 24/7 Mornings.